I hope you enjoyed listening to the wonderful speakers on the first day of the conference. Today we have another three eminent speakers, and I'm here to introduce one of them, and that is Miss Katie Wood. Katie Wood is a child advocate and trained child forensic interviewer for Teddy Bear Children's Advocacy Center of the East Carolina University Brody School of Medicine in Greenville, North Carolina, USA. Katie has worked in the field of child abuse and neglect for the past 21 years. She provides crisis assessment and intervention, advocacy and support services for children during abuse assessments, including medical evaluations and forensic interviews. She helps prepare children for difficult examinations through promoting resilience and coping strategies while identifying unique needs to effectively provide assurance and information to reduce their fears and anxieties. She works as part of the multidisciplinary team, including law enforcement, social workers, and medical providers to ensure best outcomes for children and their non-offending caregivers. She assists children and advocates on their behalf to promote their health and safety while maintaining the integrity of the investigative process, allowing successful prosecution and justice for victim children. She provides court testimony as needed in criminal court hearings. Prior to working at the Children's Advocacy Center, she worked in the mental health field in early intervention, providing case management and high-risk intervention to children birth to 2 years old and their families. Katie trains professionals and students about advocacy, recognizing and reporting child abuse, and the importance of collaboration that occurs within child abuse investigations and the Children's Advocacy Center. She is the internship site supervisor at Teddy Bear CARC for Human Development and Family Science, Child Life, and Criminal Justice students. She has a Bachelor of Science degree in Child Life from East Carolina University in Greenville, North Carolina. She balances work and family and takes great pride as wife and a mother of three teenagers. I would like to thank Dr. Preeti Desai for connecting us to Katie. Thank you so much, Katie, for accepting our invitation to be the speaker for this conference. Katie will be speaking on advocacy working with children and families in maltreatment. Over to Katie.
I would just like to say it's my pleasure to be here, and I thank you for having me. And I thank Dr. Priti Desai for recommending me for this talk this afternoon about this very important topic. Child abuse is something that is really difficult for many to hear about, and so I appreciate your willingness to hear about this topic that I am so passionate about, and obviously is my life's work. I've been doing this for 21 years. So I'm gonna hopefully give you some food for thought as far as reporting, let you know a little bit about what we do at Teddy Bear Children's Advocacy Center and how my training in human development has helped me and assist me every day working with the patients that I see and the families. So I'm going to try to share my screen with you and start my PowerPoint. Okay. Maybe. There we go. Okay. Can everybody see my screen?
Yes, ma'am, it's visible.
Okay. So I'm going to be talking about working in advocacy in the Child Advocacy Center with children and families in maltreatment. Teddy Bear is an acronym. It's for Tender Evaluation, Diagnosis, and Intervention for Better Abuse Response. And this was the name of the first grant that was written so that Teddy Bear could open their doors in 1992. So we've been doing this for about 28 years. So just a little bit about our team. We're talking today about interdisciplinary scope of human development, and you can see that we have a very diverse team. We have a director that writes grants that help keep our doors open. We have a clinic manager that runs the clinic and helps with any crisis situations that we might have. We have a forensic pediatrician, as well as 2 pediatric nurse practitioners. We have forensic interviewers and child advocates. We have one family advocate right now. We have trauma-focused and evidence-based therapists. We have community educators. We have multidisciplinary coordinator that we serve many counties, so he helps coordinate the teams in the various counties. And we also have admin support. What I would like to point out here is that I mainly work as an advocate at the moment, and each of these disciplines has their own set of what they're trying to achieve during the appointments. And so as an advocate, if the doctor's main focus is to get a medical evaluation, I want to keep the child's needs first and foremost. What does the child need? How are they communicating this need? As well as the family, because a lot of times these caregivers that come in are in crisis and they aren't handling things well. And so I think it's really helpful that I can just kind of take the child and focus on the child and help them through this process, which is really helpful. The feedback that we get from parents is very helpful. So when they come to our center, they are referred by the Department of Social Services or law enforcement. Typically, law enforcement is going to be involved with almost every case. Department of Social Services are involved when it's a caregiver specifically. And when I talk about children during this presentation, I'm talking about children birth to 18 years old. And the non-offending caregivers are the caregivers where the children typically are residing at the moment, and not the person that has offended
Excuse me,
them.
ma'am.
Sure.
Excuse me, ma'am. Ma'am, I think your slideshow is stuck. It was still looking at the first slide.
Okay, it's showing red, so maybe that's why. Let's see.
Ma'am, maybe you can stop sharing your screen and then share it again.
Okay.
Or if you would like to forward it to one of us to play the slideshow, if you're having technical difficulties.
Okay.
Katie, if you want me to, this is Preeti. If you'd like me to, you can just say next slide and I can forward it. I can go to the next slide if you want me to do that.
Well, let me try this one more time.
Yeah.
Okay. Can you see it now?
It's still the first title slide.
It's still the first slide. Okay. Let me see if I can forward it. I wish I would have forwarded this to you before we started, Dr. Desai.
Or just go to the next slide.
I clicked on the next slide.
Are you on full screen?
Well, I was. Right now I'm trying to get back to make sure it's still sharing. It looks like it's sharing the screen. So you can see it. It's just the first slide. Is that what you're saying?
Yeah, we can only see the title slide.
Mm-hmm. What about now? Still just the title?
Yes.
Okay. Let me see if I can. You may forward it to you, Dr. Desai, or?
Sure. And then, Natasha, would I have control to pull up the PowerPoint?
Yes, ma'am, you can share your screen.
Okay.
Let me think. Sorry. Okay, I sent it.
Okay.
While we're doing that, is it?
Well, I'll pull it up.
Okay, let me. So let's see. I think I was talking about referrals and getting them from social services and law enforcement. So basically, what happens is there's been a referral, there's been an outcry, there's been somebody that's worried about a child, and it's reported to authorities. And those authorities call us, and we do the evaluation, which consists of medical evaluation and a forensic interview. We also do provide therapy, but for purposes of today, I'm talking specifically about the child medical evaluation and the forensic interview. I'm going to keep going through these slides. I'm sorry y'all can't see them. So I'm going to talk about the different types of abuse. Emotional abuse is the first one I'm going to talk about. Do you want me to stop sharing my screen so that you can share yours instead?
Yes.
I'm sorry, my mind is like going different ways here. Okay.
And the title is, okay, you keep talking, I'll pull it up. It's Child Advocacy PowerPoint, right?
Yes, I think I just labeled it presentation when I sent it to you.
Okay.
So we're going to talk about the different types of abuse. Let me go. So the emotional abuse is the first type I'm going to talk about, and it's attitudes or behaviors towards children that create serious emotional or psychological damage. Many of the children that come to us probably have experienced emotional abuse. Most of them that come to us that are reported is physical and sexual abuse. We'll talk about that in a moment. Some of the indicators that you might see from emotional abuse are speech disorders, lag in development. That is one of the top ones that we see in children that come to see us, just that their development is so behind. Low self-esteem. Sometimes they're just really angry and aggressive. They do have some mental health issues such as depression. Sometimes they're suicidal, delinquent, or attention-seeking behaviors. There's also neglect. Children are seen for basic needs not being met, not being supervised. Their well-being is threatened with harm. Sometimes they're abandoned by their caregiver. Their medical needs are not attended to. They're just constantly hungry, or they're not dressed appropriately. Sometimes they fall asleep in class and their hygiene is poor. Children have fatigue. Sometimes they do have self-destructive behaviors. So these are some of the things that you're looking for with neglect. So then we're going to talk a little bit about physical abuse. It's the non-accidental physical injury to a child. It might be hitting the kid or kicking them, burns sometimes. Children come with bite marks. All of these things cause physical impairment in some way. And some of these indicators might be unexplained injuries. Kids are nervous or hyperactive. They can be aggressive. They can fear their caregiver. They can be withdrawn, maybe shy or really passive. And sometimes they're wary of physical contact. So some of the types of sexual abuse or is any sexual behavior that's imposed on a child. And this might be, fondling and actual sex with the child, or penetration of some sort. It can just be like voyeurism, child porn, suggestive behaviors or comments. Some of the indicators that you might see with sexual abuse are exhibiting sexual behaviors that are not age appropriate, having detailed or very sophisticated understanding of sexual behavior, sleep disturbances or nightmares. Sometimes their development regresses. And so this is where your human development is really important when you see the various types of abuse and you see children starting to regress in their development. They were doing this skill and now they're not. They were sleeping through the night without wetting the bed, but now they're not. Maybe they had speech and now they've stopped talking so much. Maybe they used to suck their thumb, now they're sucking their thumb again. And then of course, children that have genital issues or sexually transmitted infections is always concern. So there are consequences for victims of these types of abuse. Sometimes you see, especially in adolescence, they start using drugs and alcohol. Sometimes there are eating disorders, and we see this even in really young kids, like 9 years old. It starts really early sometimes with these kids. Depression, anxiety, they start hurting themselves. Cutting is probably one of the biggest things that we see as far as self-harm, and then suicidal tendencies. just thinking that they're better off not having to endure what they are living through. And then many times, their teen pregnancies are preceded by experiences of sexual abuse. Are you guys able to see the screen now? Desai, were you able to share that?
Yes.
Okay, very good. So I'm on grooming and secrecy now. Grooming is behavior by an offender. They're trying to do everything they can to gain access to children. And so they're putting themselves in one-on-one situations where they can have free access to the child. They're really doing everything they can to build trust and love with the child, so that maybe even the child thinks that they're participating in the abuse, and then they'll feel like they're going to get in trouble, so they don't want to tell anybody because they feel like they're actively participating. Sometimes there are bribes or threats, whether it's real or implied. You know, it might be that the offender is the breadwinner, or maybe he owns the house that the family lives in, and the child knows by telling they're going to be homeless. Or maybe they're bribed with a trip, or maybe a cell phone. That's a big one. But they use every resource possible to keep the child from disclosing. And some of the things that we've learned over the years is that even these alleged offenders will manipulate family members. Let's say a child has a babysitter and the offender's not supposed to have access to the child, but the babysitter doesn't know that. They'll do everything they can to have access through the babysitter, and we've actually seen that recently. So they're going to try to have access to the child one-on-one as much as possible, or make the child feel like they wanted the abuse. So really, grooming is manipulation rather than grooming. Typically, grooming is a positive thing for most people. So manipulation is probably a better word. So we talk a little bit about what to do if a child discloses. So there are some things that you can do that show care and concern and are helpful, such as listening to what the child has to say, telling the child that you believe them, making sure the child knows that it's not their fault. I've had a child recently express to me their concern, and adults are responsible for their actions, not children. So helping children understand that it's not their fault to be able to tell. Sometimes children are really worried about what's going to happen to the offender because they told and it's their fault. Letting children know that you're going to share information with somebody that can help them. Many times we are not that person that can help them directly, but connecting them to the right person. But there are also some things that you can do that may not be helpful at all, such as making promises that you can't keep. Like, I'm going to keep this a secret. I'm not going to tell anybody. Pushing for details about the abuse. Your role really is just to listen and hear what the child has to tell you, and not push for details. Asking leading questions can be harmful to the assessment. Maybe the child is going to use words that you said and not words that the child knows, and so it appears that they're being coached by someone else. So you have to be really careful and just get what the child wants to say. And then, of course, talking about it with people that aren't involved in helping the child and helping with their care can actually be really hurtful to an investigation once it starts. So these are some things just to keep in mind. You know, if you're working with children, I'm assuming if you're listening to this, you probably have some ambition to work with children and families. But if not, you're going to be in a family. You're going to have neighbors. So this applies to anyone and everyone. There are some steps to reporting. In the United States, there are mandatory laws. Everybody is a mandated reporter. And in some counties, there is repercussion for making false reports or using your child, you know, in child custody cases. But that's very rare. Most of the time, if you make a report in good faith, you know, you don't have to investigate abuse. I think that's one of the main things that people worry about, is that you just have to have suspicion. You have to worry about a child being abused, and then you make that report. In India, there is a protection of children from sexual offenses law, and it requires mandated reporting as well. And that includes all citizens, parents, neighbors, teachers, professionals, therapists. We have people call lots of times. They want therapy for their child, but they don't want to. They don't want to report it. They don't want it to go to the authorities. But we have to let them know that we are mandated reporters and that it has to be investigated if they come for therapy for us. And we highly encourage parents to make those reports or let us help them make those reports in those situations. So child abuse rarely stops without intervention or help or some reason for it to stop. And so if a child comes to you and tells you that they've been abused, you might be the reason why that abuse stopped. So if a child does report to you, just remember that sending them back into their environment only leads to them continuing to be abused. So we're going to talk a little bit about situations that should be reported. I know this is sort of a long list, but when you're working with children and families and you have a child in your care that's been injured, were they injured doing something that they're not developmentally able to do? That would send red flags. The injury is too severe to have been caused in the manner that's reported to you. So let's say they have a burn, but they say it's a bug bite. There are certain areas, and I'll show you a little diagram in one moment of high suspicion areas and low suspicion areas. So injuries are to the child's buttocks, genital area, abdomen, the back, and sides of the body, or hands. Those are places where injuries don't always naturally occur. And if they do, there's typically a good reason for it. So those areas would be ones that you'd want to pay attention to. The story of how the child was injured changes if they're challenged. Let's say they give you one of those stories that the child's not developmentally able to do, and you question them about it. And then they say, oh, well, you know, this happened yesterday. Maybe that's what it is. And then they come up with even another story. So that story continually changes until they think they've hit on something that you're going to believe. Sometimes the injuries haven't been treated. You see a child and they're complaining of, you know, wrist hurting or something that you feel like maybe needs to be medically treated and the parents don't want to take them, or burns that aren't treated. Injuries that show a pattern. I'm going to show you that diagram in a moment. We'll have some pattern diagrams as well. Human bite marks. Parents do use that as punishment sometimes. Sometimes patches of hair pulled out, maybe scalp bleeding, multiple injuries on multiple parts of the body of various stages of healing, where it just looks like, you know, they're getting hit often or things are happening to them on a regular basis. Burns to the child's body that just don't appear accidental, that just seem very concerning. And then, of course, if a child discloses to you, that would definitely need to be reported. So, Dr. Desai, can you see the diagram? It says accidental or non-accidental injury.
Yes.
And there's a picture of a little kid, and the low lighted areas are the low suspicion areas. You know, babies are crawling and they knock their head. They fall backwards, they hit the back of their head. Of course, the shins. I mean, kids that play outside, we actually like to see that. Kids are actually playing outside and not on video games. But some of the high suspicion areas are the ears. We see a lot of injury, and a lot of times it's both ears, not just one. Very concerning for child abuse. And then, of course, what we just talked about, the genitals is not a place where you would typically see an injury of various types. And then, of course, you know, the back. Sometimes on the spine, like the bony areas, you will see some bruises and things like that. Some of the patterns that we see at the bottom of that, I hope you guys can see that. The buckle and a belt, the loop, and of course the switches are things that we see most often in our center. We do see hand marks occasionally and some of these other marks, but those are some of the most common. At the bottom of this sheet, you'll see a little hand, and the hand is darkened. And that is called an immersion burn, where children are placed into something really hot and cause a burn. So you can literally see a line where the burn is. Those are very concerning. Of course, if you see a child and they give you an explanation for this, you have to judge whether you think that that's something that's plausible. But that might be a call to authorities to make sure that, that child is safe, especially if you've had concern before. Okay, so I want to talk a little bit about myths and facts of abuse. The first one, and these came from the National CAC statistics and research, and these were from the top 10. I just took a few. So children are victimized by creepy, psychopathic strangers, and that's just not true. Sexual abuse, 90% of the victims know their abusers. At Teddy Bear, we keep statistics on every child that walks through our door, and we're able to pull those statistics. And we rarely have stranger listed as someone as the abuser. I would say it's more like 99.9% of the kids that we see at Teddy Bear know their abuser, whether it's a mom's boyfriend or dad or uncle and the other thing is that women aren't abusers. And of course, we do see some of those as well. That's a growing population, unfortunately. Children usually tell someone they're being abused. The fact is, and research shows, that most kids that are victims of abuse really don't disclose, or is a very delayed disclosure. Maybe it happened to them as a child, they never told anybody, but they're telling now. We have lots of parents that come in to our center that say that they were abused as a child and they never told anybody. Sometimes we're the first people that they've ever told. Because it happened to their child. Many children lie about being abused. We hear this so often at our center, that children lie all the time. They lie about everything. But the truth is, the false allegations coming from children and even adolescents are very uncommon. Research shows about 2 to 10% of cases are false. So that means that when kids disclose to us, we need to believe them. Children with disabilities are less likely to be abused, and that is false. Children with disabilities are actually 2 to 3 times more likely to be abused. Sometimes these children with disabilities have difficult care. Sometimes they don't have verbal skills to say what they need or how they're feeling or what's going on, so they do sometimes have behavior issues. Or they just don't have the verbal skills to tell, and so they're just good victims because of that. So one of the things that we try to focus on at Teddy Bear is prevention, and I mentioned that we have 2 community educators, and they are trying to get the word out, and they have a program called Darkness to Light, and they do talk to families, caregivers, and professionals in our area to try to get the word out how to prevent. Understanding why children don't tell is huge. You have to understand how difficult it is for children to talk about these things. It's shameful to them. Sometimes they just don't have the words to say what happened. The consequences are too great compared to just keeping it a secret. Knowing how children communicate difficult information. And we all know that many times kids communicate to us through their behavior. And so if you're noticing behavior changes, there might be a reason why they're having behavior changes. We need to listen to them and find out what's going on. Being able to talk openly about body parts and using words that are normal and appropriate for body parts and not coming up with cute little nicknames. That happens a lot where parents just can't call body parts what they are, and so they make up names, and then people are confused when they do disclose about what kids are trying to say. Letting kids know that our job is to protect them. I know for me as a parent, my kids always said they would have trouble talking to me about certain things. Then I would tell them to find somebody that would listen. Go tell your aunt, your uncle, your counselor at school, your favorite teacher. Tell somebody. My job is to keep you safe, and I can't do that if I don't know what's happening. And I never want you to feel like you have to keep it a secret. I think a lot of parents' feelings are hurt. They feel like they should be the ones to know. The kids should come to them. But really the important thing is that they tell, so it stops. Minimize the opportunity for offenders. If you know someone in your area is a sex offender, don't let them babysit your child. I know that seems very crazy to say, but we see that so often. Moms that have boyfriends, maybe find somebody that you know and trust other than that person to babysit. It just gives them opportunity. So minimizing those opportunities. I want to talk a little bit about ACEs. I don't know how much you guys know about ACEs and adverse childhood experiences, but it describes traumatic experiences in a person's life before their 18th birthday. And that means that, you know, abuse that they've endured, neglect, whether it's physical or emotional, or household dysfunction, mental illness, violence, divorce that's contentious, parents using substances or abusing substances. Maybe a relative has been incarcerated, dad's in jail. And all of these things, each of these things has a score to it. You would give 1 point for each of these things, and it gives you an ACE score. And once you have that ACE score, your experiences from your childhood shape who you are. And it can actually have physical, your body can have a physical reaction later in life. You might have high blood pressure, diabetes, you might have other chronic illnesses, back pain, things like that. Your body holds that sometimes. And so finding out your ACE score and understanding those implications, you learn what they are, and then you find resources, and then you start improving those things and learning how your resources can help you with those things. It gives you protective factors, coping skills, and it also breaks the cycle of abuse in your family. So if you were raised and you were physically abused, sometimes the tendency is you're going to physically abuse your child. So breaking that cycle in your own family is super important. So I encourage you to look into ACEs and learn more about that. That's a whole nother day and topic. So I just wanted to thank you again for having me. I've talked really fast. I agree with some of the folks that spoke in the slides in the beginning, how important human development is for our everyday lives, not just what we're going to do in our careers. But I can say as an advocate that it has helped me to be able to understand children, understand how they react in a crisis, understand, like we just said a minute ago, how they communicate difficult information. And I'm the liaison between the child and the adults, whether it's the med provider or whether it's the forensic interviewer. I can let them know exactly what the child is saying, what are their fears and concerns, and what's the best way to address that. I have a toolbox of resilience, coping skills that I can help the child with so that they're able to get through their forensic interview and their medical exam. And, you know, I hope that I make a difference in at least one child's life. And I feel like that's why I do this work. Is it time for question and answers, or are we good on time?